Avoid blueberries if you are on these medications. Have you ever wondered if the seemingly harmless blueberry could interfere with your medications? Let's reveal the details and uncover why you should avoid blueberries if you're on specific medications. Number 1. Anticoagulants. Consider Jane, a 65-year-old lady, enjoys having a blueberry smoothie in the morning. She has been managing her atrial fibrillation with warfarin, a popular anticoagulant, for years. After seeing some strange bruises one day, she decided to be checked out by her doctor. Until Jane explained her new daily practice of eating blueberries, the doctor was perplexed. According to a research in the Journal of Food and Drug Interactions, vitamin K, which is essential for blood clotting, is abundant in blueberries. The efficiency of anticoagulants such as warfarin may be hampered by the high amount of vitamin K, thus increasing the risk of bleeding or clot formation. It's critical to closely check your vitamin K consumption if you use blood thinners. Incorporating blueberries into your diet could potentially counteract your medication's efficacy, putting you at risk for severe health issues. Just a reminder that we left all the scientific studies mentioned in the video in the description. Number 2. Diabetes medications. John, a patient with diabetes, was thrilled to learn that blueberries can help regulate blood sugar and decided to increase his intake of them. He quickly discovered, though, that his blood sugar levels were erratic, which made it more difficult to control his diabetes. Blueberries are thought to contain natural sugars and chemicals that might influence blood glucose levels, according to research published in the Diabetes Journal. The combination of these natural sugars with diabetic drugs such as metformin might result in unexpected blood sugar spikes or reductions in those taking them. When it comes to blueberry eating, diabetics need to exercise caution. Despite its many health advantages, blueberries' natural sugars can conflict with diabetic treatments, resulting in poor blood sugar regulation. I sincerely ask you to watch the video until the end because at the end, we will provide important information on how to safely consume blueberries correctly to avoid any related problems and gain only the benefits of this food. Number 3. Antidepressants. Sarah, who struggles with depression, turned to her daily blueberry oatmeal habit for comfort. But she started having more anxiety and mood swings, which made her question whether her diet was the cause. According to a research published in the Journal of Psychiatry and Neuroscience, serotonin levels may be impacted by substances contained in blueberries. When used in conjunction with other popular antidepressants, SARS, selective serotonin reuptake inhibitors, can cause serotonin syndrome, a disorder marked by disorientation, an accelerated heartbeat, and elevated blood pressure. It's important to think about possible connections between your food and antidepressants if you take them. Despite their many health advantages, blueberries may worsen symptoms or have unfavorable interactions with some drugs. Number 4. Antibiotics. Mike was eating a lot of blueberries to strengthen his immune system as he healed from a bacterial illness. But he also saw that his symptoms lingered longer than normal and that his recuperation was slower than anticipated. Research published in the Journal of Antimicrobial Chemotherapy indicates that ciprofloxacin and blueberries may interact with one another. Antibiotics may be less effective and cause illness to last longer if their ingredients prevent the body from absorbing them. Blueberries contain these chemicals. Avoid eating blueberries when receiving antibiotics to ensure they function as intended. Their combination may make it more difficult for the drug to be absorbed, which might prolong recovery and increase the risk of antibiotic resistance. Number 5. Blood pressure medications. After reading about the heart-healthy advantages of blueberries, Linda, who was on prescription drugs for her hypertension, began including them in her diet. Her blood pressure readings started to become increasingly unpredictable, which surprised both her and her doctor. Blueberries' high flavonoid content has been shown in studies published in the American Journal of Clinical Nutrition to have blood pressure-lowering effects. While most people find this helpful, people using blood pressure medication may experience issues or even hypotension. Keep an eye on how many blueberries you eat if you use blood pressure medication. Their organic ingredients have the potential to intensify the effects of your prescription, resulting in dangerously low blood pressure. Number 6. Statins, cholesterol-lowering drugs. Emma started eating blueberries since they are good for the heart, and she was taking statins to control her cholesterol. She suddenly began to feel weak and had muscular soreness, which are normal statin adverse effects. According to research published in the Journal of Clinical Lipidology, statins and blueberries may interact, increasing the risk of adverse effects such as myopathy. Blueberries' polyphenols have the potential to intensify the drug's effects, harming muscles. When taking statins, it's crucial to be careful how much blueberries you eat. Their combination may exacerbate adverse effects that affect general health and muscle integrity. Now, I'm going to show you how you can consume blueberries correctly to avoid any related problems and gain only the benefits of this wonderful food. Without this information, watching the video up to this point wouldn't make sense, so pay close attention. While blueberries offer numerous health benefits, it's crucial to be aware of their potential interactions with medications. Here are some tips to safely enjoy blueberries. 1. If you're taking medication, it's important to talk to your doctor about your diet. 2. Moderation is key. To reduce possible interactions, enjoy blueberries in moderation. 3. Keep an eye on your health. When adding blueberries to your diet, note any changes in your health or the effectiveness of your medications. 4. Remain educated. Keep up with the latest findings on interactions between food and medications. 5. Timing is important. Take into account when you should take your meds and consume blueberries. When taking some drugs, it may be less likely that they will interact with blueberries if you take them at a different time of day. 6. Dietary variety. Make sure your diet consists of a range of meals, fruits, and vegetables. This gives you a wider variety of nutrients and lessens the chance that you would eat too much of any one meal, which could interfere with your medicine. Despite being a nutrient-dense food, blueberries may interact with some drugs, which might be harmful to your health. Before making any big dietary changes, always get medical advice, especially if you're using medication. You can minimize any negative effects while still reaping the advantages of blueberries by being aware and cautious. If you want to learn more about foods that appear to be 100% healthy but actually have side effects or health risks in some way, I have prepared this video especially for you. Click here to watch.